Hello, I'm Dominic Davis, founder of Pink Therapy. We've been training mental health specialists worldwide to work with gender, sex, and relationship diverse clients for many years. This podcast puts the lives of some of these incredible, pioneering therapists front and center and gives us insights into what it's like to be LGBTIQA+, or as we prefer, GSRD, speaking in their words. Hello, everyone. I'm Dominic Davis, and I welcome you to our fourth podcast. And I'm joined today by Dr. Eduardo Perez. And you have other surnames, don't you? Do you use those in Britain or not?
No. So I shortened my name for English purposes because Latin names are very big. So my full name is José Eduardo de Carvalho Pérez, but I use just Edu Pérez or Eduardo Pérez because it's just easier.
All right. Yes, I know you as Edu. And pronouns?
He and him.
He and him. So tell us a bit about yourself, where you live, work, where you're from.
So as I said, a lot of things. I'm from Brazil originally. English is not my first language. That's what we were discussing just a minute before starting recording about my concerns with the English language. But I currently live in London and I'm working as a medical doctor. So I work in the field of sexual health. I've been working with sexual health and HIV for the past year. But in Brazil, I used to work as a GP within the sexual health realm as well, because that was my specialty interest, and also with gender identity healthcare. So I was involved with the hormone therapy and transgender health and primarily access of care. I'm also trained as a psychosexual therapist from Brazil, and I'm now accrediting this to the UK. It's a whole process that it takes a while. And also I had some experience working as a sexual health advisor here in the UK and working as a GSRD counselor as well. And I'm now...
You were the first GSRD counsellor the NHS ever had on their books, not employed, but had on their books, yeah?
Yes. I was the first person to be assigned this title in the NHS. I think we do have GSRD counsellors in the UK prior to me, but never in the NHS. So yeah, that's a trend-setting moment for me.
And for us at Pink Therapy, that they created this title particularly for you, or a role particularly for you. And transgender health is one of your passions, isn't it?
It's definitely one of my passions. So it was something that once I finished med school, when I graduated, actually throughout my med school, I wanted to work with LGBT health. And I've always been drawn to work with the more vulnerable or I would say the more vulnerable in a way, communities. So when we look at transgender health, there's so much limitation of access to healthcare, the social determinants of health, which is things that are beyond the health domain, but involve social care, environment, politics. When we look to transgender people, transgender community, they are poorer, and it's beyond when we think about transgender politics, there are many things that try to block and diminish their access to several institutions, political institutions, and one of them being healthcare. So I wanted to be a change in that, and that's been something that I've been trying to specialize within LGBT health. But I like to think of myself as a triple threat, because I have clinical skills as a doctor. I'm training as a mental healthcare professional, and I'm involved with the political activism that requires social care requires. So I'm trying to be good in these domains so I can work with LGBT health, and transgender health is definitely my passion.
Thank you. That's great. And I guess during this podcast, we're going to talk a bit about your experience of being a Brazilian living in London, but also you're still very connected to your country. we were talking a few moments ago about you doing guest podcasting back there. And I know that you have an Insta following there and you do a whole lot of information. Oh, Magnus, the parrot, is with us this morning and he's just decided to start singing as well. So that's going to be good.
Hello,
so what is life like for GSRD folk where you live? Now, tell us a bit about where you live in London and South London, but also tell us about Brazil.
So I think it's good to do the comparison because when now things in London are becoming a bit harsh for GSRD communities, especially with the current situation with all the politics in the UK, the changing of politics, it has become quite violent, and the hate discourse it's building up in a way that we experience already in Brazil. So even still, I feel quite comfortable being an LGBT person myself in the UK. I feel safe here. And this is really important when you compare to Brazil, because Brazil, even though it seems to be this country that is very welcoming and very open, very liberal, in reality, it is not.
It's not all carnival, is it?
No. We just sell this image, and this image has been sold for such a long time. People do think Brazil is this very open-minded place, and we cherish the body, we cherish the samba, and this is actually just really good marketing they did some long time ago, and it's not like that. Brazil is one of the most LGBT hateful countries, so I think it is one of the countries that are most violent towards LGBT people, GSRD people that we have. When you think of transphobia, Brazil leads the charts. Almost half of all transphobic crimes happen in Brazil. We do have the data that was raised around hate and violence around LGBT people, GSRD communities in Brazil. Is actually quite poor because of the last government that we have with Bolsonaro in the presidency. It's not a safe country. So one of the reasons that I actually decided to move to London was due to be a victim of hate crime. I received death threats as being a doctor that works with transgender care, worked with for the LGBT community. I received death threats after Bolsonaro's election in 2018, and I wanted to move to the UK for personal reasons, also because my husband works here. Many things, but one of the things that was actually a turning point for me was actually being a victim of hate crime, and it was in the streets. I heard things. I had people say that now that Bolsonaro was elected, I was gonna people like me were gonna die, or our days.
It emboldens people, doesn't it?
Yes,
it really emboldens them. Yeah.
Yes, because they have someone who represents them in the biggest seat. So they feel that they now have a leader which they can just follow. And that's pretty much what happened. So we do have we had a rise in crime happening, and actually access to basic human rights, not only healthcare but political rights involving access to education, access to housing benefits, access to basic benefits that people do need, and they affect GSRD community more. It's actually being very. It became quite difficult with the current government, but it's not something that is new. It's something that's been part of Brazilian history. So Brazil is actually quite complicated to live for if you are part of the gender and sexuality diversity community. When in comparison to London, I would say rights are now being started to be taken. So the deprivation of access and deprivation of rights, it's something that is starting to happen, I think, after Brexit. I think Brexit has not been good for you guys.
For sure.
And the outcomes are still not here, but we're starting to see how people are gonna be impacted. And usually, when you think of social impact, it tends to be worse for LGBT people, and we have to consider intersectionality. It tends to be worse for people of color,
Yeah.
for working class and people who don't have access to wealth, and also LGBT people. And
Absolutely.
then within our community of diversity, we do have to think how gender diversity tends to be more impacted with these limitations. We have a very strong transphobic movement going on now with the gender criticals in the UK, and I'm very concerned about that, how this is actually developing.
Sure. For here, I think we're fearing our rights being rolled back, our legal protections being rolled back, whereas in Brazil, they weren't there to start with.
Yeah. When you think on paper, we do have lots of rights. So, for example,
okay, correct me, please.
Yep. Gay marriage in Brazil is something that is allowed. Because we have different political systems. So Brazil, it's a federalist country. So right. we have a president, but we don't have a monarchy to start with, and we don't have parliament per se. So, and we have a judiciary system. So we have a Supreme Court, and the Supreme Court. So it's not part of the Constitution. Many of the laws that have the progressive laws, they're not part of the Constitution, but they have been ruled by the Supreme Court. So they became, in a way, an understanding that is accepted by law. For example, when you think about gay marriage, we are allowed to marry since 2012. We are allowed to adopt since 2008
as individuals.
As individuals and as a couple as well. Since 2009, if I might be wrong with the dates, law is not my field yet. No. We do have access. So we have.
What about changing your gender documents?
Since 2009, you can change your documents. So we have gender recognition by law. It's not part of the Constitution yet. We do have actually guidelines or guidelines from the Ministry of Health, tackling issues that are specifically for LGBT health. So we have protocols for LGBT health and transgender health. They are part of the main guidelines. PrEP, we have access to PrEP even before here. So the healthcare in Brazil was based on the NHS. So we do have a public healthcare system that is universal. Anybody can access, even if they're immigrants, even regardless of their money in their bank account, and it's free for everybody. And you have free access to all medications. So PrEP has been provided for free in Brazil since 2018. So it was even before in the UK. So law it has improved and improved before the current government. So improved when we had specific left-wing governments such as Lula's and Dilma's government from 2003 to 2016. We had lots of improvement in progressive areas, such as areas that are involved in the GSRD community,
right?
And lots of backlash I think we. How do I say that word? We walk back.
They walked back the rights.
Yes.
Or the environment. It sounds like the rights are still there, but there's a kind of toxic environment that inhibits people living their lives authentically. Is that
and deprivation?
More?
No, not only that as well, but deprivation of access and funding. So federal funding has been cut from the source, from the foundation. So and that's been a main issue, because if you don't have funding, they basically, I think one of the first things that this current government did was to close the HIV and STIs department in the Ministry of Health, and that completely cut funding for that department, because it was inserted in another secretary, which changed the funding, changed investment for some things they're very needed for some communities as well. And this is just one example.
So where would people with STIs go if they close the departments? To
We
their
don't
general
have
doctor?
We still have the clinics. So in Brazil, we don't have sexual health clinics per se. They're amalgamated within GP clinics, and we have centers for testing and advising. So usually they're close to each other. You test in one place. If you test positive for anything, you're then redirected to the GP clinic, to the closer one to you. And then we do have some specialist clinics for infectious diseases. They run specific clinics for HIV, hepatitis, and so on.
Okay.
So that's why I was involved. Being a GP, I was involved with sexual health and gender health because of that, of this particularity of how the system works. They still exist, but if you don't have enough funding, you don't have enough staff. And that's something that is happening here in the UK as well with sexual health clinics, because there was a shortage of funding for sexual health clinics. We are overworked and short-staffed as well. So it's very similar to what happened in Brazil before. The lack of funding actually limits this access in the way that you don't have enough clinics going on. You don't build new clinics. You don't have enough staff to work with people, and that limits access to healthcare for those people. So it's something that is happening now. It's starting to happen.
Sure.
We're now starting to see, even with monkeypox now, we're starting to see how these effects of lack of funding or lack of investment actually affects people.
Yeah. Now let's move on a little bit then to looking at what you're working on in particular, because I know you just mentioned monkeypox, and I know that you've been tweeting about that, and that's something that's been taking up a lot of your time with sexual health. Tell us a bit about your work with that, and how that's been impacting your service and your clinic, but also any other research or projects that you're involved in.
So monkeypox, to begin with, it's been impacting quite a lot. I think it changed the dynamics for all sexual health clinics in the UK, and it's been something that is changing dynamics for everyone who works in sexual health in Europe right now. It's impossible to talk about monkeypox and any other infection without tackling the issue of global health. The way that we are not distributing funding, or the way that we're not actually looking to global health without thinking about vulnerable people. So we do have infections, we do have things happening in other parts of the world that need investment, and they need to be approached from how to first developed countries, instead of just thinking of approaching these things when they happen to us, because this is somewhat of the discrimination that is
so preventatively rather than firefighting.
Yes. And in this current condition, I feel like I became like a firefighter, but they just gave me this water bottle, this plastic water bottle, to fight this huge situation.
Little plant mister. Yeah.
Yes. Yeah. It's something that we are concerned for the past 2.5 months, since give or take a few weeks in that, since this current outbreak started. We have been seeing this affecting GB, MSM, so gay, bisexual men, have sex with men more. So it is an issue for us who work with LGBT health and gender and GSRD communities. But it is really important to say that monkeypox is not a sexually transmitted infection.
No.
It is transmitted through close contact and intimacy, and it turns out sex involves both. So
who'd have thought?
Who'd have thought, right? And also one thing that we have to praise the LGBT community is the fact that we are very involved with our sexual health, and we adhere really well with this access of care. So sexual health, in a way, it's the first door of entrance for many LGBT people within the healthcare institution. So that's why we found monkeypox quite easily in that community, because we know gay, bisexual, men have sex with men, but we know LGBTQIA plus as a whole, whenever they have the opportunity to have access of care, they go through sexual health first, because that's part of our history, right? At some point in our history, the concern about HIV and AIDS became a thing that we, as gay men, mainly gay, bisexual men, we became quite aware of. So we knew that we had to go and look for treatment, or go and look for prevention. So that was one thing that was actually quite positive with tackling monkeypox. And monkeypox has been taking lots of our time. It changed the dynamic of the access for other things, such as work with chemsex, work with counseling, work with PrEP, work with actually dealing with the STIs, the main ones, because STIs are still happening. And we do see an association of monkeypox because of the sexual network and the sexual activity that is related to the transmission of monkeypox in this moment, even though it's not an STI. They're still being diagnosed. So there is a correlation of more than just one diagnosis of monkeypox and something else that needs assessment on sexual health clinics. But monkeypox is not the only thing that I'm working with, and monkeypox vaccination as well. At our clinics, we work with several things. So we work with PrEP and PEP, which is basically, if you've been living on Mars and don't know what PrEP is a pre-exposure prophylaxis to HIV and HIV only. So we still recommend use of condom to prevent from other STIs. We work with PEP whenever use of condom has not been done and PrEP has not been taken, or there's any other risk factors or risk exposure to HIV, is the post-exposure prophylaxis. We work with managing of all the other STIs, but we work specifically with some other clinics that I like. We do have a clinic focusing on sex workers. So we see lots of immigrants, and mainly immigrants from South America. We do have lots of Brazilians within that clinic. So it's
helpful that you're there then, huh?
Yes, I have the pleasure to speak in Portuguese. So basically, my regular day-to-day basis is working and speaking in Portuguese, Spanish, and English.
Perfect.
So yeah, by the end of the day, my brain feels like mashed potato because I have to change into language. So sometimes when I get home, my husband's from Spain, and we speak in Portuguese to each other because we met each other in Portuguese. But sometimes I'm just mixing words. I don't know which word is from which, and it feels very arrogant sometimes when it's like, oh, I don't know how to say that in Portuguese anymore because I've just been saying this word in English. But that happens.
Sure.
And we do work with sexual workers. We do work with chemsex. We do have a clinic in association with other clinics as well. So we have other services that are amalgamated to our sexual health clinic, and they help with the assessment. And we do lots of reproductive health as well. So contraception. There's gonna be a clinic for gender surgeries. So it's gonna be an assessment for gender surgeries happening at our clinic.
Great.
I think that's something new. They're trying to evaluate how they're gonna set up the clinic, but I think it's gonna be by the end of this year. So there's gonna be, and I'm happy because I'm gonna be involved in gender assessment.
Finally, in a way. You'll get back into gender.
Finally, I'm gonna get back to gender. Yes, but I'm passionate about everything sexual health and gender related. You know that.
For sure. So I guess that also touches on some of the current challenges facing our community and your clients or patients. Yeah. So does that touch on what are you passionate about?
It does. I think as time goes by, I've become quite political with my work, and even with my approach to work, because I cannot disassociate. And this was something that it was not clear to me when I decided to work with LGBT health, how political that was going to be. It was very naive back then, but now it's more clear to me how access of care and how social environment and social determinants of health are so important within this work.
Yeah.
But that's when I think of the main challenges for our community within the healthcare setting, because that's the place where I can speak with some knowledge and competence. That's how politics actually are involved. So changes in politics that diminish our rights or diminish our access to basic things that treats us members of the GSRD community as second-class citizens, how they affect in the actual outcomes, in the actual day-to-day life. So when you start to listen to discourse, to hate discourses about potential risks of being transgender, potential risks of exposing your children to LGBT propaganda, or how conversion therapy should be something that we should be allowing in a way, not allowing in another, and it's not allowed, and it should not be allowed in any way whatsoever. When these types of discourses are being when these types of conversations are being held without taking care that our mental health and our actual health or physical health is being affected, this is something that these are the things that I'm seeing from the healthcare setting, the healthcare perspective. There being the main concerns or the main things that we should be worried as a community, and we should be trying to tackle and trying to approach in a different way. And I feel in a more assertive way. I feel that we're being quite calm and quite observant of what is happening, and things are changing fast. And our rights are being taken quite fast as well. So changes in the Gender Recognition Act, changes in the gender rights in the UK are happening very fast. And we struggled quite a lot to overcome Section 28 and overcome the changes that we now have politically, because they impacted positively in the healthcare. And for that to be taken away, it's very easy and it's happening. So I think I kind of spoke about that. And it was very naive of me not to think that politics and being involved with that would be something that would actually be necessary for the job that I want to do and that I already do. But it's something that we do need to raise concerns.
I don't think one can do work with in GSRD without a commitment to social justice. It's actually got to be the starting point, I think. There needs to be a commitment to social justice there. So tell me turning to our course, because you're currently on our diploma program, so you're on the second year. Tell us what motivated you to undertake the program.
I think I told you about the triple threat thing. And I felt I really wanted to have a course that prepared me to claim myself the title of being a LGBT specialist, somebody that works for and with the community. So when I did my research, I could not find any other course that was as complete as speech therapies, and that actually approaches so many different things that we working as healthcare professionals, mainly thinking of mental health and how everything that we've been discussing affects our mental health in one way or another, to be resilient or actually as a stressor, as a negative stressor. How many of these things we do need to understand better. And I thought I had some knowledge, but after starting the course, I feel that my learning curve has been ascending so much with the amount of actual good academic content and material that we have, the course has. And I couldn't find, and you know, I like research and I like reading, and I couldn't find anything else that was as complete as speech therapy. And that's why that was one of the decisions that I took to actually start the course. And I'm very happy that I'm in the course. I feel, and I think I tell you this many times. But thank you very much for letting me be part of this.
I'm really glad you're there too. What for you has been the most interesting part or module? What's the best bit for you, if there is a best bit? Thinking hierarchically, I find that hard.
Yeah, I mean, horizontally, everything is. I really like everything. Everything's kind of in the same. Everything's in the top. So I think I was saying that I was watching this reality TV show, like singing TV show. They ranked people, but it feel like everybody was a 9 point something, and they were ranking because everybody was so good. I think all the modules are very, very good. I'm just ranking the ones that are slightly more in my realm. Tell me. I loved for the first year. I loved the intersectionality module. I think that was also for me. I don't want to use the word turning point again, but it made me think differently of the way I like to approach things. So So this whole political aspect kind of became more flourished after the intersectionality, because I also identified so many new intersections within me that I can actually empathize and relate with my patients.
Right.
So the gender identity module was amazing. Thinking of the modules that I'm doing now in the second year, I don't know if I should be doing the advertising, but whoever's interested in go to the second year, there's a module about working with sex workers that was very, very helpful and useful, because I could actually apply this to my work from the get-go. So it was even before actually reaching the assignment and the module itself, I was reading the material because it was already helping me to actually work with my clients. And the chemsex module is another module that I really liked. So I liked all, but these few have been my favorite ones. Yeah.
Sure. And how has it changed your practice? You mentioned that with the sex workers, it's helped you inform you about their context. Is there anything else you want to say about that?
Because it kind of provided me a way to actually draw a framework to work with. It felt very vague the way I was working. It felt like I was working within someone else's framework, whereas now I could actually develop my own. So a way to actually start my consultation, finish my consultation, know what I want to ask, and know what I want to have within the information that I actually need. Because I don't work only as a counselor. Mental health is part of any healthcare professional, and I think it's something that every healthcare professional should actually know, especially working with LGBT and GSRD communities. So I now managed to craft my consultation to be a clinical, but also assessing mental health in a way that actually the course has provided me enough tools to actually change my framework. So I can say now that my consultations, I'm known to be very talkative, as you might have seen.
Noticed, yeah.
And my consultations, they tend to also allow this space for conversation, because I don't do the medical consultation only. And I feel
you're working holistically. Yeah.
Yes, yeah, and I think work with GSRD communities, and that's pretty much 99% of the people that come to sexual health clinics. It helps actually adapt these consultations and being part of the course. It helped me adapt the consultation not to be only clinical, but being very person-centered and holistic. So I'm also known not for being only talkative, but also getting information that patients don't usually disclose in all their consultations. And I think the course has been very important for that, because I can use some of my counseling skills within the clinical skills. And this helps with safeguarding, this helps with approaching issues that wouldn't easily be approached. And also, that might be the first time that somebody's going to listen to that, and I can refer to other services. So as a whole, the course has been very helpful for me to actually change the dynamics of my consultations and change the way that I can actually help people. Because in the end, that's why we work with healthcare, to help people improve their lives and their quality of lives.
For sure. Thank you. So I am always learning, and this field never stops feeding me. And my students are the ones who teach me a lot, so much, really. So recommend me a book or a film that you've seen and you think I might like to know about. You're so excited. Any book or film. It needs to be in English, okay? I can't read it if it's in Portuguese.
So I'm reading this book now. It's called
Queer Intentions.
Queer Intentions by Amelia Abraham. It's a personal journey through LGBTQ plus culture. And it's actually super nice. So Karen Gurney gave me this book as a gift, when I left my placement at TransPlus. And it took me a while to start reading it. So, and it feels like it's a nice narrative of LGBT stories. It tells personal stories. It's mixed with interviews, and the way Amelia writes is actually catching. So I feel ashamed that it actually took me a while to start reading, because I was reading another one. I was actually reading Mind the Gap by Karen Gurney.
All right, yes.
I always recommend this one. It's for anyone who's interested in psychosexual therapy. I think it's a must read.
It's a good book. Yeah.
And the list of GSRD reading recommendations that I was involved with. I kind of read a few of those. Movies.
No, you only needed to give me one. It's okay.
So go with the books.
That's a great one because I haven't come across that.
Yeah, Pre-Intentions.
And as a fairy, I grant you 3 wishes. How are you going to use your wishes?
Can I start? I feel like Miss Universe. I want to end poverty in the world. I don't know. Can you disappear all bigoted people in the world?
That would be nice, wouldn't it?
Yeah. I want bigger pecs.
You have to work the gym in that, I can't.
Oh yeah, you're a genius. No, you don't grant miracles. I don't know. I want to eat chocolate and not have any acne. I want to. I want trans rights to be respected everywhere else. And I think I got my 3 wishes, right?
I think you've had your 3 there, at least. At least you've had 3.
Yes.
You might have even mentioned 4, but that's okay.
Yeah, you didn't allow the pecs one. That's
Okay, well, thank you very much, Edu, for joining us today. And I look forward to seeing more of you as you progress in your career, because I think you're going to be a bit of a bright star in our sexual health field, and I'm excited to see more of what you're doing.
Thank you, Dominic.
You so much.
You inspire me. So thank you very much. Thank you very much for that.
Thank you for listening to this podcast. Please click like and subscribe to hear when the next one is released. If you're a therapist looking to enhance your knowledge and skills with GSRD clients, please check out our training website, pinktherapy.org. We run 1- and 2-year specialist training programs online, as well as offer a wide range of short CPD modules. Thanks again for listening to On Becoming a GSRD Therapist.